Welcome back. It's 9:41. Time for our Plastic Surgery Today segment with our sponsor, Bay Area plastic surgeon Dr. Stanley Jacobs, who has brought along a patient today. Good morning.
Good morning.
All right, so Dr.
Chris.
Stan, yes, this is Chris. Okay, so Chris, you got, I'm gonna say an ear job. It's called
an otoplasty.
Thank you. I'm sorry, ear job.
Yeah.
So you had the ears that were sticking out. You
Right.
had them kind of made, I mean, they look great. Let's get a close shot of you so we can take a look at the ears now. So you had this done about 6 months ago.
Right before Christmas.
So people who have the ears that are sticking out, usually they're so tormented as a kid. You went your whole childhood and now you do it.
Yeah, like you said, I was teased about it as a kid, and I got all the names called at me and this and that, and you know, I got over it. It was always in the back of my head that I wanted to have it done. I just never really did it.
Yeah.
But now that I've kind of progressed in my career, I do a lot of public speaking, and I'm with clients every day, and just decided to do it.
So it was always kind of in the back of your head. You see on the left, there are your ears. And of course, when you're a little kid, everything's bigger, so your
Right.
ears are bigger proportionally. But so it always bothered you, but you just, it's a plastic surgery thing. You feel like, ooh, plastic surgery.
Yeah. I kind of felt, you know, I was young, male, and having plastic surgery was just kind of weird, but
Yeah.
the more I researched it and the more I talked with Dr. Jacobs, you know, I felt a lot more comfortable about doing it.
Right, and you called him basically out of the blue. You saw him on crying. I love that. And you're thinking, hey, you should do. So he comes to you,
Right.
and he, as a patient, is worried about, like you said, you know, I'm a guy, plastic surgery. I don't want to make a big deal. Plus the work angle, he doesn't want to miss work.
Yeah, the healing time is very easy for patients. They have minimal swelling, there's no pain. It's really one of the easiest things to recover from. So that is a good thing. And he had seen somebody else who talked about a different technique, which is cartilage cutting, where they take a strip of cartilage behind and then fold the ear back. The problem is that cartilage, now you have two edges. And on the front, you'll see like a ruler edge. And it's impossible to line that up and make it curved, right? So I told him I don't believe in that technique. There's another technique called Mustarde, which is the name of a surgeon, to roll a cartilage back, to sew it, but that takes some technique to get the roll, the edge just right. This is called the anti-helix, because if it's flat here, you can roll it back.
Just roll it back.
And then put the sutures, and they're behind the ear, as you can see.
Yeah.
So there's just an incision
I don't know if anybody else can see, but I can attest to this.
You can't see.
Does that hurt or anything? So. Yeah, I don't see a thing. I mean, it's just that's where the ear joins the head. I see kind of a line. That's so. I see you're married. You know, what did your wife think of this? It's like after all these years, you're an adult. Suddenly, you're going to change your ears.
You know, when I first brought it to her, she was a little bit surprised. Like
she married you with the big ears. She liked the big ears.
Exactly. But you know, I told her I really wanted to do it, so she was all all for it. She was behind me, and she likes it now. Yeah.
So do people notice? You know, it's one of those things you're always going to want to, or no?
People don't notice, actually. That was one of the things we talked about. I wanted something natural, and I didn't want people to see a big drastic change.
Right.
People don't notice unless I tell them. They go, oh, okay.
Right, they just say, oh, something's different, but who knows what it is.
Yeah. Once I tell them, they're like, oh, yeah, okay, yeah.
And I see the next thing, you're working on the teeth.
Yeah.
I love it, like you're 33, now you got the teeth, you got braces.
Right.
Good for you.
Yeah.
Simple things that we can do, and that doesn't sound like a big deal. So.
No, it's an easy recovery. And how long did you take before you went back to work? Or
like 10 days. I think it was right around the holidays, so I had time off for the holidays and everything. So.
Oh, good tip. That's right. You said it was in the winter. And it was good to wear a little hat. So that's a good tip if you want to do that. Do it in the winter.
Yeah.
Okay. Thanks a lot to both of you. And if you have any questions or concerns, you want to check out Dr. Stanley's website, drstanleyjacobs.com, and there's the number on the screen there, 433-0303. We'll be right back.